This week on The Job, we'll take a comprehensive look into the world of pharmacy. Bobby John visits Auburn University's Harrison School of Pharmacy, where he'll get an in-depth lesson in the various aspects of this viable career. We'll also offer current job and training opportunities from around the state. That's coming up right now on The Job.
If you enjoy the field of medicine and you like helping people, then it's safe to say the Harrison School of Pharmacy at Auburn University has just what the doctor ordered. There is a growing demand for pharmacists in the state of Alabama. With projections to grow by 22% by the year 2016, availability for jobs in this field is already on the way. As a matter of fact, CareerBuilder has posted over 60 pharmacy-related jobs in the state and over 3,000 in the nation. There are only 2 schools in the state where you can get education to be a pharmacist: the McCorder School of Pharmacy at Sanford University and the Harrison School of Pharmacy at Auburn University. We visited Auburn's pharmacy program to get some information on what it takes to be a pharmacist and the process that students go through to become a licensed pharmacist. Dean Lee Evans, who has been with Auburn for 14 years, explains to me the need for pharmacists.
But there's going to be a significant demand for pharmacists in the future, many of whom may not be practicing out in the 4 walls of a pharmacy. There's all sorts of other wonderful opportunities that exist. I can do the medication therapy management part for you without having to be in a pharmacy. I can do that anywhere. We even have students doing it in people's homes now. So it's a dynamic environment. The whole opportunity to get involved in all sorts of specialty issues. I mean, I mentioned I was a psychiatric pharmacist. I've got people that are cardiology specialists and gastrointestinal disease specialists and pediatric people, and all sorts of things that begin to align with medicine. Those individuals get heavily engaged at the bedside, if you will, and taking care of people and determining how those people ought to be best treated. And frankly, they're at their best when they're in an interdisciplinary team and contribute all over. I guess my functions are my passions really right now, and since I've been here, is to help improve the educational programs and to help really change the face of pharmacy practice, which has been undergoing a tremendous amount of change over the last 35 years. So the folks who are trained here today are truly clinicians, and their responsibilities are to assure the appropriate and optimal use of drug therapy in patients. So that's a little different than what you typically see in community pharmacies, because most people say, well, they're putting pills in a bottle. Well, they're doing more than that, and you'll find more and more pharmacists who don't do that, but deal with you in terms of trying to make sure that your medications are controlled and being used in an optimal manner. So that's kind of what our program is all about. Students spend 4 years here learning how to treat people with drugs.
So, what all is involved in teaching students how to treat people with drugs? Well, first, we should identify the role of a pharmacist. Dr. Jared Johnson, clinical assistant professor, explains the misconceptions of what a pharmacist does, as well as the steps that a pharmacist takes to fill a prescription.
Yes, and we have a large misunderstanding or misconception about what community pharmacists do. And I think Jerry Seinfeld at one time even had a little routine where he said,
"Clear out, everybody. I'm working with pills up here. I'm taking them from this big bottle, and then I'm going to put them in a little bottle."
So the question always comes up, what is going through a community pharmacist's mind as he stands behind the counter and as I wait for my prescription? And so the first thing is, as we get your prescription in general, we have to analyze, is this medication at this dose proper for a patient of this age. That's the first thing. After we determine that, then we need to determine other patient-specific factors. Is the patient allergic to this medication? If so, we need to request something else from their physician. Beyond that, is this patient on medications that might interact or cause a bad reaction alongside this medication? If so, then we need to be finding them something else. And so there are a whole number of things that go into the process, and that's why pharmacy school is so long. 4-year program, there's a certain knowledge base that we have to be able to provide medications to our patients and teach them to use them safely and effectively.
Being a community pharmacist is just one of several jobs and locations that a graduate of a pharmacy program can take. Pharmacists are also needed in hospitals, grocery stores, pharmaceutical manufacturers, government agencies, and a host of other locations. Pharmacy school graduates may also decide to work in research and development of pharmaceuticals. This is also taught at the Harrison School of Pharmacy. Dr. Charlene McQueen heads the Department of Pharmaceutical Sciences and is Associate Dean of Research and Graduate Studies. She explains pharmaceutical sciences and the importance of research and development.
Okay, well, pharmaceutical sciences covers what's basically pharmaceutical sciences. So we're the people who help to do the research to put the pills in this bottle. We're the scientists who study how drugs work. We identify new targets for treatment, new therapies, figure out what's the best way to deliver that medication, and study whether or not it actually works. So all those are types of research that can go on in this department.
And when can a student experience going through, I guess, the pharmaceutical sciences?
Well, from the teaching aspect, they interact with faculty in this department from their first semester. There's a series of courses called Drugs and Diseases, and that's where they learn how you treat certain conditions with medications, how the medications work, sort of the mechanisms of action. So the pharmacy students, the PharmD students, are interacting with faculty very early. Some of them may decide to do a rotation and come into a research lab and actually do the hands-on laboratory experiments. But our other student population are graduate students, and those are students who are studying either for a master's degree or a PhD, and they're going to go on to become research scientists in government with pharmaceutical companies, or come back to a university and teach the next generation of students.
And you're saying some key words there, scientists and next generation. How important is it in your field for scientists to actually research this field?
Well, if we don't have people doing the research, you're not going to have new medications to put in these bottles. So the types of work that we do are really fundamental to the drug development process. So we're training the scientists who are going to go into the pharmaceutical industry and discover those new medications and figure out what's the best way to deliver them. Is it a pill? Is it an injection? Is it one new delivery system we haven't even thought of? And so if we don't train that generation of scientists, then there's going to be nothing new to put in here.
Another important aspect of pharmacy is the ability to interact and educate the patient. Aside for dispensing medication, pharmacists will counsel a patient on the use of the medication, health changes, and other general education about the patient's health. Dr. Berger is a professor and head of pharmacy care systems. He explains their philosophy.
My research focuses on health behavior change and how to help patients improve the chance that they're going to engage in healthy behaviors like taking their medicine the way they should, but also talking to patients about behaviors that support managing their illnesses, such as if they have diabetes, losing weight, eating healthier, exercising, stopping smoking, etc. And so our coursework, our required coursework, actually talks to our students about health behavior change and how to have an impact and influence on the patient without causing defensiveness. And we've also created an institute here at Auburn that's now nationally known. It's called AU Mighty, which stands for Auburn University Motivational Interviewing Training Institute, where we've had 6 of these institutes. It's a 22-hour-long weekend program where we have physicians, pharmacists, health educators, nurses, social workers, psychologists come in and learn about health behavior change and the impact on the patient.
Well, today what I'm going to do is actually ask you a few questions to make sure it's not causing any problems, and then we're going to do a blood test to see how your cholesterol levels are doing. Is that okay?
Sure.
Oh, wonderful. Have you had any headaches or dizziness, tiredness?
No.
No? Okay. Any trouble sleeping or changes in your sleeping patterns?
No.
Okay, that sounds wonderful. What about your stomach? Have you had any stomach pain or abdominal pain, any nausea?
No.
Any diarrhea, gas or bloating or anything like that?
No.
Well, that's wonderful too. Okay, and what about muscle aches and pain or muscle tiredness or any unusual muscle feelings in your muscles?
No, none of it.
None? Okay, that's wonderful. Now, when you were here last time, you and I talked about getting your blood work done to check on your liver. And did you have that blood work done?
I did. I did that right away, and my doctor's nurse called me and told me that everything was fine.
Okay, that's wonderful, because before you started taking this medication for the first time, we need that baseline lab work just to make sure that your liver functions good. So we have that on file so we can compare it periodically throughout the year, just make sure that there's no problems. Okay, so that's wonderful.
Right. Another unique aspect of the program that's really different than many schools of pharmacy, our students are assigned to patients the day they walk in the building. So our first semester students are part of a team that's composed of P1, P2, and P3 students and 2 faculty mentors that are actually assigned 15 patients in the community that they see, and they actually assess their drug therapy. Through one of our clinicians, we can actually talk to physicians and make changes in drug therapy in order to have patients have more effective drug therapy or to eliminate drug therapy that might be unnecessary.
And that not only prepares a student, but also gives back to the community, it looks like, too.
Absolutely. And it gets our students talking to patients in a real setting. They go to the patients' homes. So that one of the things that we're trying to do with that aspect of the program is get our students familiar and comfortable with patients with different socioeconomic backgrounds, different cultures, so that they begin to get used to talking to a culturally diverse population, because they're going to have to. And if we wait until their last year, it's too late.
We have heard from some of the professors and the dean of the Harrison School of Pharmacy. When we return, we will get a glance of Auburn's pharmacy program from the student's perspective, as well as a sneak peek of a mock trial given during orientation. But first, here's a look at this week's job and training opportunities.
This week's job and training opportunities include production trainees, multi-craft maintenance technicians, electricians, and production operators. All these positions are for pre-employment training through AIDT, unless otherwise stated. In Calhoun County, Kronospan is seeking production trainees for its state-of-the-art medium-density fiberboard facility in Oxford. Wages will start at $13 per hour for successful trainees with a high school diploma or GED, stable work history, and excellent attendance record. Applicants should also possess a mechanical aptitude, excellent communication skills, strong reading, writing, measuring, and math skills, an ability to work rotating shifts, and the ability to handle physically demanding work. Kronospan also has immediate openings for a multi-craft maintenance technician, electrician, production planner scheduler, and stockroom clerk. In Lee County, Sohan Auto USA, Sohan NTN USA is seeking production operators. A supplier for Hyundai Motor Manufacturing Alabama and Kia Motor Manufacturing, Sohan will manufacture front and rear axle assemblies and drive shaft assemblies at its Auburn facility. Wages will start at $9.50 per hour for candidates with a good work ethic, cooperative attitude, and a willingness to actively participate in a team environment. A high school diploma or GED is required. That's a brief look at some of the training and career opportunities available this week on the job. For more information on these and other opportunities, visit our website at www.onthejobtv.org.
Students who attend Auburn's Harrison School of Pharmacy are not your ordinary student. This is because the application process is handled a little differently. Shanika Weeks is a third-year pharmacy student, or P3, and she explains the application process for entering Auburn's pharmacy program.
The application process to get into pharmacy school is a lot different. It's more involved than what you would do to get into undergrad. It involves going through online process, PharmCast. It's like a centralized application process. You go through that, and then if you get accepted into the pharmacy school or they like what they see, they actually invite you for an interview. And once they do that, it's a day of events and a lot of questions, just trying to figure out who you are as a person to see if you could actually handle the curriculum here at Auburn, how you would work well with people. Do you have that personality in order to succeed? So it's a lot more in depth, but it's definitely worth it.
So if you think you just walk into the program, you got another thing coming.
Definitely another thing coming. It's a lot more competitive. I think on average we get hundreds of applications to come here, and each class holds about 125 or so members. So it's very, very competitive and much more involved.
Once the new student arrives, they have a week-long orientation. Part of their orientation consists of a mock trial of a malpractice case. This trial involves arguments and deliberations of a fictional $375 million civil suit against a pharmacist. Participants in the trial are made of actual community pharmacists, lawyers, and pharmacy school staff who play either their regular career roles, the defendant, the victim's family, witnesses, or members of the jury.
In the Court of Harrison School of Pharmacy, case number CC05 HSOP 08125, John and Mary Thompson, plaintiffs versus Chris Michael, defendant. All rise. Court is now in session. The Honorable Jacob A. Walker presiding.
Good afternoon. You can be seated. At this time, we will proceed with the opening statements. Mr. Triggs.
Thank you, Your Honor. Ladies and gentlemen of the jury and of the audience, I have something I want to show you. I have to show you that which I cannot bring to you. This is Jessie. And she would be here if and only if this man right here had bothered to get on the phone. That's it. If you, after hearing in this trial, know nothing else about this case, it's that. Now this case is about malpractice. It's not about redemption. It's not about what we can do to bring her back, because we can't. There's no amount of money in the world that will ever replace their daughter. However, you may punish. You may punish with your verdict, and you may punish as high and as hard as you like. And the reason we're going to ask you not only to attempt to compensate them, but also to punish with your verdict, to render a civil fine, if you will, is because this man has, as a pharmacist, responsibilities to the public, to his patients, and particularly to Jess, because he knew her. He worked with her. He was actually counseling her about her medications. And the reason she was having to deal with doctors and pharmacists is because she took a trip, and you'll hear the testimony, she developed a blood clot in her leg, and that blood clot needed to be treated in order to keep it from causing her death. If that blood clot stayed in her leg or broke up or something else was wrong with it, it could have gone into her lungs, it could have caused a stroke, it could have caused lots of problems for her, even her death. So it was important to monitor the medicine she was on.
We got a call from the hospital that said she was in intensive care unit. We needed to come as soon as possible.
And did you do that?
We did.
And when you arrived, what did you find?
She was in a coma.
Did you get to speak to her at all?
No, sir.
Dr. Candace Farley is a PGY1 resident, and she explains exactly what that means for a pharmacy student.
A residency program allows you the opportunity to further your studies. Instead of going right into the practice of pharmacy, you get an additional year of intense training. We have our last year is kind of a clinical rotation where you rotate through various areas. Well, this is kind of like an intense version of that. So before I hit the actual field of pharmacy, I'll get an added training. I'll be able to precept students. I'll be able to work with and without the guidance of a pharmacist. I'll be able to do the things that I'll be doing in the next year. So it's added, that kind of like a postgraduate added.
What advice would you give to, say, a student who's in high school right now that wants to be a pharmacist, and they may want to think there's some skills they need to brush up on? I mean, it could be anything. What advice would you give to them?
My advice is you need to follow your dreams. And if it's something you really want to do, work hard for it. It takes hard work, but the rewards are endless, like I've said before. And you know, you just got to hit the books. But you know, don't let the books be your whole life. And like we've been learning here, you have to have other aspects of your life, especially social, because that's a main part of what we are learning here today. Not just academics, but how to deal with people. And I say if someone in high school really wants to become a pharmacist, you know, you got to know your stuff, but you got to know how to be social and know how to work with people.
And you know, being one of the I guess one of the best, you know, progressional educational programs in the state, you know, what are the admission requirements to the School of Pharmacy at Auburn?
Well, we have been one of the few schools that have taken the lead in actually increasing our admission requirements in terms of pre-pharmacy education. Most doctor of pharmacy programs are 4 years that are preceded by 2 years of pre-pharmacy education. And we took the step a few years ago. We're not the first school that did it, but we were probably one of the first 5 to 10 that did it, to move to a 3-year pre-pharmacy requirement and include additional biological sciences in our prerequisite requirements. And so to be considered for application at Auburn, you need to have completed our 83 hours of prerequisite requirements, or be in a position where you're going to complete them prior to entering school for the year that you anticipate going into school. We have a minimum GPA requirement that is based on our GPA calculated on our prerequisite coursework that is 2.5. However, most of our applicants that get admitted, you know, have GPAs 3.0 or higher, and our average entering GPA is around a 3.3 to 3.4. And so we certainly look at how a person has done academically during the pre-pharmacy portion of their college career. We also require applicants to take the Pharmacy College Admissions Test, or it's also referred to as the PCAT. And that's really a test that looks at both prior knowledge and also aptitude for pharmacy education. And it's a test that is given several times a year at various centers throughout the United States. And we're really generally looking for somebody that scores at 50th percentile or higher on that examination. We also particularly look at the biology and chemistry subscales, because the test has 5 different subparts. And we're particularly interested in how they do in biology and chemistry, and like to see those at 50th percentile or higher, because you know, pharmacy is a discipline that is based strongly on both chemistry and biology, and so you have to have a good working knowledge of those. But we're also looking beyond somebody that you might say is just a science geek. I mean, you know, we're a people profession, and one of the things that is important is how people interact, or one of the things that is important is how pharmacists interact with those patients that they serve.
And, you know, for a potential student, you know, why would you recommend the School of Pharmacy at Auburn University?
Well, a tremendous number of jobs. There's a huge shortages in pharmacy, but I think perhaps more importantly, it's a way to really serve people. They do a tremendous job at all the technical skills here in our School of Pharmacy, but they also teach the human side and the communication skills, the lifestyle changes that interact and link you with the people throughout the state. And if you're interested in research, some of the research that deal with their pardon me, with their work and the research that deals with programs that improve the efficacy of drugs, and particularly in the way they're prescribed and the way they're carried out for health care. So there's a lot of opportunities both on the research side, to the community drugstore, to other health care centers, to hospitals.
Well, we hope you've enjoyed the show this week. I'm your host, Bobby John Drinkard, and we'll see you next week on The Job.
If you have questions, comments, or suggestions about this or any other on-the-job program, feel free to contact us via email at feedback@onthejobtv.org or mail us at On the Job TV, 1 Technology Court, Montgomery, Alabama, 36116. Next week on The Job, we'll focus on 2 educational institutions. First, we'll visit Wallace State Community College in Selma and learn about the careers in masonry. We then travel to Auburn to learn about their Building Sciences program and the careers associated with it. We'll also share with you the job and training opportunities around the state. That's all next week on The Job.